concerns raised about these 6 cases concerning and understand the need for caution, I also recognize that more than 6.8 million people in this country have already received the Johnson & Johnson vaccine. So even if a clear connection is established between those negative outcomes and the vaccines, the fact is that they are very rare. So I'm personally not too concerned. What I am concerned about is encouraging people to get the vaccine when they can. Everyone is eager to get life back to normal, and the vaccines are the best tool that we have, along with our masks, to make sure that that happens. We're on the verge of our largest expansion of COVID vaccine eligibility since we administered our first dose in Sonoma County back in December. As of tomorrow, anyone 16 and older who wants a vaccine will be eligible to get one. Of course, that doesn't mean that everyone who wants one will be able to find an appointment. We have more than 411,000 residents 16 and older in Sonoma County, and our vaccine supply remains extremely limited. From the beginning, we have done our best to gradually expand the pool of people who could get a vaccine. We started with our frontline healthcare workers and long-term care facility residents, those most vulnerable to the virus or those who have had the worst outcomes. Then we opened to our oldest residents, 75 and older, before expanding to 70 and then 65 and older, because our seniors have been disproportionately impacted by COVID. At the same time, we use our limited supply of vaccine to target essential frontline workers like teachers, farm workers, emergency service operators or workers. We kept our focus on equity, and we used our partners at the federally qualified healthcare centers to get the vaccine to underserved and vulnerable communities. But starting tomorrow, the floodgates will open. Thanks to our early progress, we have already partially vaccinated more than 50% of our eligible population. More than 1/3 have been fully vaccinated, so that we're nearly halfway to the 75 to 80% needed for that much desired herd immunity. The challenge for us will soon shift from finding enough doses for everyone who wants one to convincing more people to want to get one. We are going to focus our briefing this evening on vaccine hesitancy, the reasons for it, and how to overcome it. We hope to dispel some of the myths and disinformation out there that are driving some of this hesitancy, and we will learn how to talk to vaccine hesitant people and potentially change their mind. We are joined today by Dr. Brian, as I've been told, Brian Prystowsky. And again, I'm sorry, Brian, if I butchered that. Brian's a pediatrician with Sutter Health who faces vaccine hesitant patients and parents nearly every day, as well as Dr. Jenny Fish of Santa Rosa Community Health. We also have Kate Pack from our epidemiology team, who will share some data from vaccine hesitancy surveys, and Dania Candela, our health equity manager, who can share some of the cultural concerns about vaccinations in the Latinx community. We also have Yesenia Zapata, who was previously hesitant about getting vaccinated, and who, through the course of learning more of the facts and science behind the vaccines and their safety, had a change of heart and got her first dose recently. But first, I'd like to turn it over to my colleague, Supervisor Susan Gorin, who will talk more about the recent Bay Area Council vaccine hesitancy survey. Supervisor Gorin?
Thank you, Supervisor Rabbitt. It's a pleasure to be with you this afternoon. I am Supervisor Susan Gorin, representing the 1st District, the Sonoma Valley, primarily in eastern Santa Rosa. And I've received 2 doses of the Moderna vaccine and feeling very few after effects from either of those doses. So I'm one of the success stories for vaccinations, absolutely. The recently released Bay Area Council vaccine hesitancy survey was very revealing about attitudes toward vaccines in our region. It was also somewhat troubling. According to the poll last month, about 57% who said they have not been vaccinated, 21% said they definitely or probably won't get vaccinated. And 12%, and that poses a challenge to the public health officials working to end the pandemic. Asked why they won't get the vaccine, 19% answered that they aren't worried about COVID. 14% said they're already healthy, and 12% fear a vaccine's negative side effects. Another 12% said they simply don't trust the vaccine and will rely on their own immune system to address any infection. Of note for us in Sonoma County, the North Bay, or Sonoma, Marin, and Napa counties, had the highest vaccine hesitancy rate of any region in the Bay Area at 23%. Some other interesting data that the poll found: Republicans at 31% are more vaccine hesitant than Democrats at 7%. Other groups that expressed doubts about getting vaccinated include parents, 22%, those with less than a college degree, 22%, and women ages 18 to 49, 21%. Among people that indicated a racial or ethnic affiliation, the most reluctant to get vaccinated were our Latinx community members at 18%. We know that addressing vaccine hesitancy is going to take many different messages to counter the different reasons people have for declining the vaccine. So I'm looking forward to learning more from our panelists today. And now I'd like to turn this press briefing over to Dr. Sundari Mase, our health officer, who can share more details about where we are in the pandemic. Thank you.
Great, thank you so much, Supervisors Rabbitt and Gorin, and thanks to everybody who's attending today. As most of you know, we moved into the orange tier in the state blueprint for a safer economy last week, so we'll need to remain there for at least 2 weeks. But so far this week, our metrics are continuing to drop, with 2 of our metrics already being in the yellow tier. So that is encouraging news. As of today, our adjusted cases per day per 100,000 is 3.8. That's down from 4.3 a week ago. It would need to be below 2 to qualify us for the yellow tier. Our overall testing positivity is at 1.5%, which is within the yellow tier. Meanwhile, our testing positivity in the lowest quartile of the Healthy Places Index is 1.9%, which is also within the yellow tier. Looking ahead, the governor has sent the aspirational goal of June 15th to the state to get rid of the entire blueprint system and mostly return to normal. But that is predicated on several factors, including how much vaccine supply we have and our case rate and number of hospitalizations. The best thing that we can do is to continue to follow the mitigations for our current orange tier and try to move into the yellow tier. The yellow tier will indicate that the virus is only minimally spreading in the community, and it will signal that an end to the pandemic is in sight. To get there, we know what we need to do. We've said it again and again, more than a dozen times. Continue to wear those face coverings or masks. Continue to practice social distancing. Try not to gather with people outside of your household. Make sure you're using all of the general hygiene measures, and get tested. You should get tested if you have symptoms that you're concerned about, or if you think you've been exposed to someone who has the virus. Testing helps us identify and isolate the cases of COVID, and that way decrease transmission. It helps us to identify the contacts, test them, quarantine them, and make sure that we're identifying everybody with COVID. It also helps us move through these tiers, get closer to the end of the pandemic, a time that we know we're all looking forward to. So now I'm going to turn this over to Dr. Shende, our vaccine chief, to share an update on the vaccination campaign.
Thank you, Dr. Mase. As Supervisor Rabbitt mentioned, tomorrow the gates will open and anyone 16 or older will be eligible for a vaccination. It's true that there's not enough supply to vaccinate everyone who wants a shot. In fact, after promising signs at the beginning of the month that our vaccine supply would be increasing, it's actually looking pretty tight and pretty flat right now. Thankfully, we've made good progress in getting people vaccinated. As of today, Sonoma County has administered 369,985 doses. That means that 82,977 residents have been partially vaccinated. 82,977 have been fully vaccinated, and 149,425 have been partially vaccinated. More than 56% of our over 16 population has had at least one shot, and more than 36% have been fully vaccinated. We're still outpacing the state and the rest of the country in getting people vaccinated, which is a tribute to all the hard work that our many healthcare providers, community-based organizations, and individuals, committed individuals who have been at the heart of our success here in Sonoma County. And we can't thank them enough for all their efforts. The county is continuing to prioritize equity in our vaccine distribution strategy. Our focus is making sure that we have appointments and vaccines available for our hardest to reach residents, such as homebound seniors, as well as residents in our communities that have been the most impacted by the virus. Overall, the county and our network of partners have done an incredible job with our limited supply so far. And we remain ahead of other counties our size in vaccine doses administered per population. But we continue to have more work to do as we try to achieve herd immunity and expand eligibility to our entire adult population. Now I'll hand it back to Supervisor Rabbitt.
Thank you very much, Dr. Shende. I appreciate that. And before we go to our panel for discussion about vaccine hesitancy, I want to bring in Kate Pack, an epidemiologist in our public health department, who's going to share some data from recent surveys that we've conducted on vaccine hesitancy here in Sonoma County. Kate?
Thank you, Supervisor Rabbitt. I'm just going to share my screen. Okay. No. So I just wanted to share with you some recent findings of data collection that is in progress and recently completed by the epidemiology team around vaccine hesitancy. So in this data collection, we have really set out to answer two different questions. First, what proportion of residents and staff in senior residential care facilities have chosen to get vaccinated? And then the second research effort that we'll discuss that's in progress right now is what are the main reasons that healthcare and caregiving staff have chosen to get vaccinated against COVID-19 or not? So first, looking at senior residential care facilities, why do we want to look at that population? So in Sonoma County, nearly 2,100 COVID-19 cases have occurred within senior residential care, over 1,000 of those among residents. And we know that older adults, especially those 75 plus, are at particular risk for hospitalization and death from COVID-19. Over 54% of the COVID-19 deaths in the county have been among skilled nursing facility and residential care facilities for the elderly residents. And that's abbreviated as SNF and RCFE throughout the slides here. So who was surveyed? In March of this year, facility administrators at 189 skilled nursing facilities and RCFEs were invited to participate. 83% of the facilities completed the survey. The response rate at SNFs was 95%, and the response rate at RCFEs was 82%. The key findings from that outreach were that 95% of residents at these facilities have been fully vaccinated. Among the 5% of residents who declined vaccination, this was listed as due to concerns about side effects from the vaccines, potential allergic reaction, distrust of vaccines, or being on hospice care. Among staff at these facilities, 85% have been fully vaccinated overall. However, these rates differed significantly by facility. So in about half of the facilities, 100%, every single staff member was vaccinated, but in 15% of facilities, over 30% of staff declined vaccination, and a third of these facilities had previously experienced COVID-19 outbreaks. The top reasons for staff choosing not to get vaccinated included concerns about safety approvals being rushed for the vaccines, concerns about side effects, reproductive concerns, and distrust of vaccines. It's important to note with the vaccination of 95% of the residents at senior care facilities, we've seen a dramatic drop in cases. There have been no new COVID-19 cases at SNFs and RCFEs among residents since March 5th, and no deaths among residents since February 16th. And this mirrors what we've seen Also in the general population, we have had a high proportion of adults 65 plus in the community vaccinated. Among the 65 to 69-year-old age group, 78% are at least partially vaccinated. 86% of those 70 to 74 and 87% of those 75 plus. The COVID-19 hospitalization rates of adults 65 plus decreased sharply about 6 weeks after the vaccination effort started. And you can see the orange line here is hospitalizations among 65 plus, and the blue line is among those less than 65 plus COVID-19 hospitalizations. And you can see that the rates among those older than 65 are now on par with the younger adults. We've seen similar trends in COVID-19 death rates. The lines on this chart, you can see the gray line is 75 plus year old. The orange line is 65 to 74-year-olds, and the blue line is total, looking at death rates over the course of the pandemic. And with vaccinations and decreased community spread, we've seen a decline in COVID-19 deaths among the older age groups. So now I'm going to turn to looking at the vaccine hesitancy survey that was just launched last week. We are surveying in-home supportive services workers, so in-home caregivers, staff at skilled nursing facilities, staff at residential care facilities, and staff at hospitals and clinics in the community. This data collection, as I said, is in progress. It's expected to continue through this month. So what I'm discussing are just some really high-level initial findings. The reason we're focusing on these individuals is that healthcare and caregiving staff have been vaccine eligible the longest in our community and had real concrete opportunities to make choices around whether or not to get vaccinated. And their responses can help inform public health outreach and messaging and future vaccine hesitancy data collection locally. Some general topics we look at in the survey: basic demographics, history of other vaccines, history of comorbidities, sources of information that people trust around making choices around vaccines, history of testing COVID positive, self-perceived risk of getting COVID-19, and reasons for getting or not getting the vaccine. So far, we've had 719 complete responses received as of yesterday. The majority of those have been received from in-home caregiving staff. 87% of participants so far reported having been vaccinated, and an additional 4% are planning to get vaccinated. So we have about 5% that are kind of unsure if to get vaccinated, and 4% that have decided no, they will not get the vaccine. The demographics of those submitting responses so far, 61% identify as white, 20% Hispanic or Latino. Annual income, 32% had an income of $49,000 or less. 4,000 indicated an income between 24% indicated an income between 50,000 and 99,000, majority female, and the mean age is around 52. So we asked respondents about the sources of information that they trust the most for getting accurate information about vaccines. Some of the top responses were doctor, pharmacist, scientific community, state government website like CDPH, and their family members. Information sources respondents trusted least that they reported were social media, political figures, and different sources of news, online, TV, print. You can see these responses in a little more detail here. I won't go into it too much because I know we're short on time, but on the left-hand side of this chart, you can see these are sources trusted completely or trusted somewhat. On this side of the chart, the blue is do not trust at all, pink is do not trust very much. So you can see some other trusted sources are federal government websites like CDC or like local government health websites as well. Among those who are undecided if to get the vaccine or had decided not to get the vaccine, some statements around that they said they did not get vaccinated or may not choose to get vaccinated that they agreed with the most strongly were that they thought the vaccine might have side effects that will make them sick. They thought that safety approval processes were rushed, that the vaccine wouldn't protect them from getting COVID-19. They wanted to wait till more people got vaccinated before getting vaccinated. And also the statement that the vaccine prioritizes politics over health of people. Among the reasons that people chose to get vaccinated, those most strongly endorsed were protect myself, protect my family and friends, community, wanting things to get back to normal and wanting the economy to reopen. So in summary, the data collection is still ongoing. Other research efforts are planned. This is just kind of the start. We would also like to do focus groups and outreach to the neighborhoods that have been hit hardest by COVID-19, and also really monitor the data to understand what demographics and regions have lower than anticipated vaccination rates, to identify other areas in which additional data collection could be useful. That's it.
Great. Thank you very much, Kate. That was great information. I think that obviously the proof's in the pudding in terms of, especially with those first slides regarding the vaccine works and it keeps people from getting sick. So thank you very much. We're going to open it up for our panel. I want to go to Dr. Shende and talk about, again, about the Johnson & Johnson vaccine. So to those of us who've had that vaccine, should we be concerned? And what do you know about those rare blood clots and their connection to the vaccine? And if you can, just talk about how these vaccines come to be and what happens along the way. I understand that each vaccine had at least 40,000 folks plus or minus during the study period. And now Johnson & Johnson has had 6.8 doses with six of these complications. But as I understand it, kind of narrowed to females between 18 and 40 some odd age, and I could be wrong there, but I'll go to you. And if you can give us some additional information, be very appreciated.
Yeah, so the numbers are that 6 people out of 6.8 million were diagnosed with these rare blood clots, which are called cerebral sinus venous thromboses, a very rare type of clot. And interestingly, when the studies were actually done, there actually had also been one case in the AstraZeneca as well as in the Johnson & Johnson, one out of about 30 to 40,000 people who were studied, and those were male. So far we've had 6 females under the age of 50 who have had these clots, but there had been one male in each of those other studies as well. And again, we know that this is a very rare condition. So for people who have had the Johnson & Johnson vaccine, again, the numbers are significantly against any problem happening. 6 out of 6.8 million means less than 1 in 1 million chance of any problem in this respect. But there are certainly things that people should look out for. And specifically, people should look out for symptoms of severe headache, difficulty breathing, shortness of breath, leg pain, abdominal pain, within 1 to 3 weeks after the vaccine. And if that happens, certainly please follow up with your regular physician, or if there are significant concerns, then a local emergency room. But that being said, again, many people have had this vaccine so far, both in the studies as well as in actual, post-study, and people have done very well. So it's important to be cautious, to watch out for symptoms, but for the most part, I think people are going to be okay.
And do you know how common or uncommon it is to have a pause like this? And any idea how long this one will last before we can get back that vaccine?
So there actually had been a ACIP meeting this afternoon. And at this point, they're planning to not make any decisions for the next 7 to 10 days. They are going to study this more thoroughly to get more information. So we won't have any answers on this for the next week and a half.
Well, I appreciate that. Thank you so much for that information. Dr. Prystowsky, let's go to you next. There are many myths out there that people cite for not getting vaccinated. You just saw the survey that Kate Pack presented. I'm sure that you get a lot of that information as well, or a lot of those things cited to you. There's a lot of disinformation is shared too on social media. How about a rapid fire through some of those myths, and hopefully you can dispel them with your background. What about those who say they can get COVID from the COVID vaccine?
Thank you for inviting me to this meeting, you guys. I think you can see I've been kind of pulling my hair out. So I've been thinking about how best to help people, because I think when we talk a little bit about some of these myths or reasons that people sort of use to, in some ways, justify fear. It's just been a really rough year. And I think a lot of people have been really struggling with coronavirus disease. And I think anything associated with it, the vaccine being one of those things. And I think that a lot of times when people are scared, they find reasons to justify their fear. So when you say, for example, can I get coronavirus from the vaccine? You cannot. There is no coronavirus in the vaccine. The vaccines are formulated in a very brilliant way. In particular, I think to talk probably mostly about Pfizer and Moderna, because as Dr. Shende said, for right now, the Johnson & Johnson vaccine is on hold, but those mRNA vaccines, they actually have what I sometimes will tell patients is like an instruction manual for the spike protein, which is on the surface of coronavirus. Sometimes I'll use the analogy that it's like a hat that coronavirus always wears. So you have this instruction manual for the hat that coronavirus always wears in the vaccine so that your body learns to identify that hat. And when they see it, they know that that doesn't belong here, whoever's wearing that hat, which is always coronavirus. So there is no coronavirus disease in the vaccine. You cannot get coronavirus from the vaccine.
What about those who are fearful of having some sort of side effects? Can you just talk about what people have seen, if there's any data about who has a side effect, how serious is that? And then talk about how serious that is as compared to the virus itself.
Right. I don't think that that question could be any harder than asked today, actually. I think what we learned over the last 24 hours is that while it's not common with the Johnson & Johnson vaccine, at least, this blood clot side effect is something to look out for. And I appreciate that in many ways, the VAERS system, or the Vaccine Adverse Events Reporting System, that the CDC and the FDA rely on in order to catch any sort of trends that are problematic or worrisome that we're trying to figure out might be associated with any of these vaccines. It helps all of us to know that we really do prioritize safety. In fact, I think as healers, I would say that first, even before physicians, all of us really sign a commitment to do no harm, which means that we really do feel like these vaccines in many ways are safer than coronavirus disease. And I think primarily right now, as I think Dr. Shende was saying, with 6.85 million people that were vaccinated with the J&J vaccine, most of the time these vaccines are totally safe. But when we do identify that they're anything that is kind of concerning that we need to be aware of, and also make sure that medical personnel and the public are aware of to look for, we should all know that information. Total transparency, which I think at this point, because everybody's so accessible to breaking news, I feel like we're actually pretty good at transparency. I think with regard to the common things that we see with vaccines like the Pfizer or the Moderna vaccine and the Johnson & Johnson, but I know for right now that's on pause. A lot of those, what people sort of call side effects, are mostly actually our body responding to the vaccine. So when you have a fever or muscle soreness or some body aches or chills, a lot of time what that says to me is, oh, I'm so glad it's working, because that means your body is actually responding with developing protection against this terrible disease. And so sometimes actually when people get vaccines, remember I'm a pediatrician, so is Dr. Shende, by the way, but it's when kids don't have any responses to vaccines, I sometimes get worried that they worked. So when I hear that somebody had a fever or is responding with a little bit of discomfort, for the most part, I'm usually actually pretty happy about that. It says to me that the vaccine worked. So fortunately, what happens with the vaccine, different than the coronavirus disease, is that while the vaccine is kind of a one-time dose, I know Pfizer and Moderna, you get a second one a month later, 3 weeks to 4 weeks later. you usually only have symptoms up to maybe 48 or 72 hours after the vaccine. It's not anything really difficult to manage. Whereas if you get coronavirus disease, the virus itself replicates in your body. And so you have symptoms for as long as the virus continues to replicate, which is not just a one-time injection. It can be weeks. And with long hauler syndrome, what we've learned is it can even be months. It's really rough. So again, as I said, as a healer with an intention to heal, I signed that commitment. We all in this call, and I know in our community as a medical community, really believe these vaccines are the safer option when you're thinking about comparing it to coronavirus disease.
What about some other myths that you've heard out there on the front line from those who are hesitant, and maybe the parents that you hear undoubtedly are not only speaking for their child, but probably for themselves? What else do you have to share, and what else would you like to let people know?
Yeah, no problem. I mean, I hope that maybe some of them will come up in questions. One of the things that's tough in, I think, a public forum is that, I know one of the things that you had first said in your introductions was, how can we help people kind of get convinced? And I actually think that that might not really be the right word, because one of my colleagues who I really care about, who's a national expert, talks about healthcare moving at the speed of trust. And I think that when you talk about trust, convincing sounds almost coercive. And I actually feel like when we sort of align on an intention of safety, which is where patients sometimes will say to me, I feel like this vaccine is unsafe for X, Y, or Z reasons, Supervisor Rabbitt. So it's not always, it could be a variety of things that might be in their echo chamber of where, they're hearing from friends or family. I've heard a variety of things that I know we can talk about. One of them, I think people often will bring up, particularly since I see a lot of moms, is concerns about infertility related to the vaccines. And that unfortunate myth has been perpetuated on the internet, even though there really is no scientific data to support it. And our governing bodies of the American College of Obstetricians and Gynecologists and the Society for Maternal Fetal Medicine, who really are experts for talking about what's safe for pregnant women, for women trying to get pregnant, and for breastfeeding women, all say that the vaccine is safer than getting sick with coronavirus disease. I've also heard people talk about concerns about altering your DNA. I think that's a common one that sounds in some ways like it just depends on who your peer group is and how much you hear something that at first glance may sound like that doesn't sound possible. These vaccines, particularly let's just say Pfizer and Moderna, they do not get into your DNA. So there's no way they can alter your DNA. They don't get into the nucleus of a cell. The way they work is they, again, like I said, that spike protein instruction manual gets amplified in the ribosomes in a cell, which is outside of the nucleus. And so you don't end up actually affecting DNA at all. Some folks, I have a particular connection, I feel like, to the faith community that I really feel strongly about partnering with, actually, as we move forward with regard to kind of real trusted leaders. And I know in the survey that Kate was showing us, it did not necessarily for all groups cite faith leaders as the most trusted. It's nice to see that people still trust me, but not everybody trusts me as a doctor. And I think a lot of the faith communities have struggled with the fact that while there is no fetal tissue in any of these vaccines, all of science in many ways has used fetal cell lines to be able to do research. And that's important to be transparent about. There's no tissue, but when you talk about fetal cell lines, these are old, these are from the 70s. And when you're really being honest about, kind of how we do the best we can to heal our community, this is where, the Pope has been super helpful in saying that there's a permission for Roman Catholics to get the COVID-19 vaccine. He himself has been vaccinated. And again, it's sort of a comparison of risk benefit, the benefit of saving humanity from the deaths that we've seen with coronavirus disease. It's safer to get the vaccine. We all know that. And I know that it's really hard the day after a vaccine has been put on pause to remember that, because I think a lot of the headlines are focused on those poor 6 women. Honestly, all of us in healthcare, and I think there was a 7th actually that I read in the New York Times that they're looking into. It's just so hard to hear because we all just want people to be safe. That's the truth. And if something is associated with the vaccine, we all deserve to know that, however rare. And we trust the FDA to be able to guide us with what's safe and what isn't. And I follow the rules, but my heart still believes that people should be safe. And that's the point of the vaccination campaign. Obviously, it's not to hurt anybody. So I think a lot of us are really struggling to hear that anybody's sick in whatever circumstances ever. But I do really feel like when you're talking about the safety of these vaccines, it really does outweigh any risks, particularly when you're comparing it to the risks associated with coronavirus disease.
That's great stuff, Brian. I really appreciate that. I wrote down that healthcare moving at the speed of trust. I think that is a great way to look at things. Thank you for all your work, and thank you for being here with us today. Very much appreciated.
Happy to help.
We have Yesenia with us, who was initially reluctant to get vaccinated. And I'm wondering if Yesenia is here to share her story and tell us what changed your mind, and why were you hesitant at first, and what changed your mind and moving forward?
Yes, I will start with the why I was hesitant. I would say just not having enough information of the science behind it, especially when it was new, not knowing that many people that have been vaccinated within my community and around me. But what changed my mind, I would say, was just having more information, hearing directly from these healthcare professionals that built that trust. And, just, I'm pretty sure all of us here know some people, I did lose a family member to COVID. So that was an opening of, with being a mother, I want to definitely take whatever measures or precautions that are out there to keep my little one healthy and keep myself healthy so I could care after her. And I actually got my vaccine at the Cesar Chavez event in Santa Rosa at the Martin Luther King Park. I feel what was the push there? Hi, Dr. Jenny. What was the push there was just having people from my own community, people from these community-based organizations, healthcare providers and professionals, just being my own community get vaccinated definitely was that last little push for me, and I am glad I did it. Definitely, as I mentioned, feel like it's important to take those precautions. We don't know, I myself am young, but I don't know how I would respond to COVID, and what the after effects would be on my body, also on my little one, if she is able to fight it, but the damage it does internally to her, wouldn't, as I mentioned, I want to keep her healthy, keep my parents healthy, keep all those around me healthy and safe.
I appreciate that very much. I think I speak on behalf of the entire screen by saying we're happy. We're happy for you and for your family that you did get vaccinated. I personally think that's the right thing to do. And also want to say so sorry for your loss. And it goes to show you the severity of what we're dealing with. And I think I can say, while predominantly negatively affecting or bad health outcomes for the most elderly, it doesn't mean that it can't happen elsewhere. And I've had some younger people that I know affected with COVID. And so really happy that you went that way. And thank you for being here today and telling us your story. Appreciate that very much. We also know that there's cultural sensitivities that many communities have with vaccines in general. And this is something, obviously, this country has been dealing with, and it's reared its head during the pandemic, obviously. And Dania, as the county's health equity manager, you do a lot of outreach to communities that are largely Latinx and Indigenous and people of color. What have you heard from these communities about why they are reluctant to get vaccinated? And what do you recommend as the best way to go about messaging to these communities to persuade them to go ahead and get that vaccine?
Thank you, Supervisor Rabbitt. Yeah, so, I really think and voicing really community perspective is so important. What the part of our vaccine rollout really was to incorporate and speak and address the institutionalized pieces and racism that come along with vaccine hesitancy and the whys. Like government systems and healthcare systems historically have impacted our communities of color in a way that have caused trauma, in a way that it has caused impact. So all of that embedded creates a much more complex situation when we talk about vaccine hesitancy in communities of color specifically. So really relying as far as a solution on our trusted messengers and events like the Cesar Chavez event that Yesenia just kind of that participated on, and really what shifted her gear to like, hey, there's an event here, I'm going to get vaccinated today. It really is the power of community building and community trust that will allow our community to feel like they can trust again, and that they can have a bridge to really get healthy, right? And really feel like they have an empowered decision about taking this vaccine. It's a big decision, but we want to make sure that folks are feeling like they can make one with the right tools and resources. So to answer the question, again, uplifting, I think, the voices and the work that community have so hard to do on a daily basis. They're out in community and they know there are trusted messengers. And they are, I think, as we said, the families, the friends, the organizations that people go to, and all of that into one will get us to getting a healthier community, right? That it's something that we all deserve to be healthy.
Great, thank you so much. And thank you for your work as well. It's so much appreciated. And we have Dr. Fish, and thank you for being here as well today. Jenny, many of us who trust the science have been vaccinated, know that people that we know, even family, friends, coworkers, who don't plan on getting vaccinated. And we just heard about trust building and explaining the science that makes one, that gives the information that one needs to make a decision going forward. But could you just talk about how you communicate to vaccine hesitant people to persuade them or to gain that trust going forward to make the right decision?
Yeah, thank you so much. I think it's an excellent question. And I think people like Brian and I think about it every day. This is what we're doing every single day. And I think the first thing is not to have our own agenda, right? To create a space of a conversation and trust and try to build trust. And I will completely agree with Denia that it really has to do with trusted messengers. I'll come back to that in a second, but like, why are they afraid? What concerns do they have? Like, have a conversation and address those pieces bit by bit without trying to coerce someone, without trying to really appear that we're just out to get them vaccinated. Our goal is really to educate people and answer their questions and address their fears so they can make the best decisions for themselves. Now, we obviously believe in the science, and we obviously believe that the vaccine is one of the key factors to getting through the pandemic, on top of physical distancing and wearing masks and all of those things that Dr. Mase had said. And so it really has to do with, like, who do they trust? Do they trust their faith leaders or their community leaders that they can trust and talk to, friends and family? So we also see that when people in the community are vaccinated and then share their stories and their hesitancy, like Yesenia, and show their journeys, then more people will get vaccinated, right? It's that establishment of trust, as Brian said. I think the other piece is that doctors and clinics, like, having that trust in us is amazing. And sometimes we still don't do a good job addressing those things or creating those spaces. And so a lot of us are trying to do work out in the community with trusted messengers. It doesn't necessarily work for us as doctors to just show up out in the community and be like, here, believe us, especially in communities of color that have faced institutionalized racism for years and decades and generations. And so working with trusted messengers and really following their lead has been key. And we've seen it play out time and time again. It makes a huge, huge difference. The other piece is that a lot of the clinics are doing online forums, foros comunitarios. San Rosa Community Health, for example, is doing that just to open spaces so people can come and talk to doctors without it being a visit, just more of a conversation, more of a charla. And so it really just has to do with like establishing trust, right? And understanding that people's concerns are valid, right? The concerns of racism, the questions we see is like, is this a mechanism of population control by communities that have been forcefully sterilized, right? Or by communities that have like don't have services, that don't qualify from services from the county, right? And so that don't have inherent trust in our government or our health institutions. And so that's where we're working all together. And to be fair, like our governmental institutions and our community clinics, like we don't have great outreach for the most part. And so we're really learning the value of community-based outreach with health professionals and trusted messengers. So we found that that really makes a difference. And then in your conversations with family members, again, it's about trust and hearing people out.
Again, thank you so much. Thank you for your work. Thank you for being here. Thank you for sharing with us today. We very much appreciate that. I want to go to Dr. Mase and just ask her about herd immunity. And there's been percentages bantied about 75 to 80% of the population required to get vaccinated in order to achieve that. Is there such thing as a stronger herd or a weaker herd? Is it something that, how do we maneuver through this? And can you just talk about herd immunity? And what about the people then who aren't vaccinated within that? And are they more vulnerable going forward?
Yeah, thank you so much for that question, Supervisor Rabbitt. So the thinking is, if we can get 75 to 80% of the people in the community vaccinated, then we're just going to have a lot less transmission of COVID. So a lot less opportunity for those who are still at risk for COVID to get infected. Now, when we were in the purple tier, we had widespread transmission. So you could just go to the supermarket, for example, and get exposed to somebody and get infected. Not that that wouldn't happen once there's herd immunity, but it's a lot less likely. However, those people who don't get vaccinated are still at risk. And we do see outbreaks of infectious diseases amongst people who don't get vaccinated. Pertussis is a perfect example of an infectious disease that we see outbreaks of amongst those people who decide not to take the vaccine, even though it's much, much less common now that we have a good vaccine towards it than it was before. So the point is, if you don't take the vaccine, you may still be at risk for getting COVID if exposed. If you do get the vaccine, then as long as you have antibodies, you are protected. So I think the last part of your question about should we try to get more people vaccinated, I think we should always try our best to get as many people vaccinated as possible. And if we can do that through reaching out to the most affected communities, through education, through giving people the opportunity to ask questions and allaying their fears, just like Dr. Fish, Dr. Prystowsky, and Dr. Shende have said, that would be the best approach moving forward.
I appreciate that. Thank you so much. And Dr. Shende, so the floodgates open up tomorrow, and everyone 16 and over is eligible. And I got to say that I think our county has been doing just a stellar job given the circumstances and the amount of vaccine that's been available. Logistically, we've had many different options available, but for some people it's been a challenge, right? And can you give any advice on how we go forward now that starting tomorrow there'll be another big block of folks who are excited to get perhaps their first shot? Just talk about that real briefly.
Yeah, I hate to preach the same thing over and over again, but once again, it's patience, patience, patience. We have opened up a huge group of our population. Everybody's 16 and up right now. We know we do not have enough vaccine supply to reach every single person. It's going to take time. Thankfully, we have many more options now than we did over the last few weeks. There are a lot of pharmacies that have appointments that are available. There are even more clinics that are available as well, but it's just going to take time. And over the next 4 to 6 weeks, we're hoping that there's going to be a significant increase in vaccine supply. But as with everything with this vaccine process, there's never a dull moment. There's always something else. And so nothing is guaranteed. So we just have to be patient. And as you've said before, when a vaccine is available, then take advantage of that opportunity. Yeah,
no, I think, well, I appreciate that too. And I think, we want everything immediately in our society, but a little patience will go a long way, and we will get there. And we have done, again, a good job of getting there to this point in time. And the light is on the horizon there. I am looking to Jennifer. There she is. And Jennifer, I'll let you take over and I appreciate very much all the panelists here today and all your comments, but I know there's some questions from our media members, and I'll let Jennifer take that role of calling on our good friends.
I'm honored. Thank you, Supervisor Rabbitt. So Martin, you're up first, and feel free to direct your question to a panelist, or we'll play a popcorn game.
Hi there, everybody. I was hoping that you can help me reconcile something. That Bay Area Council report or survey says that we've got the highest, or up here in the North Bay, we have I guess, a very high hesitancy rates, but then we're vaccinating at better rates than other Bay Area counties. How is that possible?
Well, I think that the studies the results are going to be variable. It depends on the population one is looking at. So we know that there is some vaccine hesitancy out there. So far, we are reaching many people who are very eager to get the vaccine. And I think we know that the challenges that we're up against are that we want to ensure that our vaccine rollout is equitable. And there's going to be a long tail of people who have concerns about vaccines, who are going to want to have questions answered, and understandably so. And it's going to take time. So there's oftentimes an initial rush to get it, and then there's going to be people who need a little bit more time to get those questions answered, and then there are going to be people who continue to want to wait. So it's going to take time. I think that the incredible success we've had so far reflects the fact that we've been able to provide the vaccine in many different ways, different formats for many people who are eager to be vaccinated. But this process is going to go on for quite a while, and that's okay, because it's important for people to be able to make that decision when they're ready to do so.
So then that I guess that suggests that that we're getting a lot of people who really want to get vaccinated, but we may hit a point where we're gonna get to the hesitant people.
I believe so, and that's not uncommon. Dr. Prystowsky and we have done this for many, many years, and Dr. Fish as well, in speaking to families who have concerns and who have hesitation. So again, it's going to take time, and we understand that. And just as everyone on this panel has said so far, it's going to be important to have that education, to have that communication, and have trusted messengers who are going to be able to answer those questions. And I'll let others on the panel speak.
And Martin,
I would just add, and thank you for the question. I always knew that we would get to this point, that we would be having great success in expanding the number of vaccines that we were receiving in the county, and working on all cylinders with our healthcare partners to distribute the vaccines. And now that we're open to everybody, the rush is on, as we've said before, and I'm so excited that we are working together collaboratively to identify those folks, to schedule the appointments for the vaccines. But and we're also working to identify homebound seniors and disabled folks, and to get the vaccines to them in their homes safely. But in a few weeks, we know that many more of our residents will be successfully vaccinated. And it's going to require us to work harder to identify those folks who are vaccine hesitant, and to dispel those fears, and really identify those that have fears. So the work is on, and we will get there. I think this community briefing will be echoed across the county many, many times, and in very personal ways, as Yesenia talked about. COVID affected her family very tragically. And as you get to meet people who've been struggling with COVID, you suddenly say, maybe it's not such a bad idea to get that vaccine.
I have, oh, Brian?
Martin, I think what you're asking, I'm looking at some of the numbers, and I think when you do those surveys, like the KFF survey or the Kaiser Health News surveys, that percentage that you're referring to is like the folks who said definitively, we're not going to get vaccinated, or we probably won't get vaccinated. So that percentage being 23% in our county means that, 77% of people are not in that range. And so in terms of access to vaccine, we could be doing really well with regard to working on that 77% compared to our neighbors. But we still have a lot of work to do with hesitancy. I know you and I have talked about that quite a bit with folks a few years back. But I think, a lot of it has to do with really listening to people, as Dr. Fish was saying, hearing what it is that they're worried about, and trying to at least make sure that they have enough information to make an informed decision, not coerce them, not convince them, but just make sure they're informed and make the right decision for them.
Thank you.
Thank you. Martin, any follow-up questions?
I did have a follow-up about the cerebral venous sinus thrombosis with the CVS. Can you tell me, because it is so rare, that reaction or that side effect, how rare is CVST in the general population? I'm looking at the Cedars-Sinai and Johns Hopkins website, and they're saying that it happens about 5 people in 1 million. And that would make it more common than it is among the 6 million people that have been vaccinated. Can you comment on that? Dr. Shende.
Yeah, that's a very good point, Martin. The point is that it's an extremely rare condition, and it's something that it's a very valid point. It's something that does happen, and possibly without any known reasons as to why. And that's why it's important that the ACIP and the CDC are going to be looking into this and taking some time to really study it. That's what needs to be done. We need to ensure that things are safe. They need to come up with guidelines as to who might be considered a safer group to be getting this vaccine. And we need to have that right information. And I think the important point to keep in mind is that when concerns do come up about vaccines or medications, they really are looked at. They're studied thoroughly to ensure that we're doing the right thing going forward. We've seen this happen in the past with pediatric vaccines. The same thing has happened with many years ago with, for example, the rotavirus vaccine. And it was paused for a while. It was studied thoroughly, and because of that, they ensured that the vaccine that was then put out was extremely safe and extremely effective. So I think that a similar process is going to happen with the understanding that the side effect that we've seen is extremely rare.
And if I can just add, so whenever a new drug or a new vaccine is introduced, it has to be studied in the general population as it's given, not just from the clinical trial, but to see how it actually functions in the community. And so what CDC and FDA will do is take a look at these cases and look at all the factors surrounding these cases to see if there's an association, causality, in other words, that can be established between what these 4 women have experienced and the actual vaccination. So a panel of experts will get together, ACIP, CDC, FDA, take a look at these cases and try to determine if there's a correlation, and if so, how strong that is. And that's the basis for which any recommendation would come out. So it's a process we do for any new drug or intervention that's introduced.
And then I just want to highlight that this actually isn't necessarily a bad thing. This is actually this is how science is supposed to work. It's exactly what Dr. Mase is saying. Like if they're watching it, and if there's concerns, they pause it, they thoroughly study it, and then they release it back if they've like, determined that those concerns are unfounded if the risk is minimal. So I just want to emphasize that this isn't a bad thing. This is actually a good thing. This is how science is supposed to work. And I'm very reassured that they're taking that step to do that so that we can, as community advocates and health physicians, we can like confidently say that they're doing what they need to do to keep us safe.
Thank you.
Thank you, Jenny. Thank you, Martin. And before we go back to a question from our media, I'd like to raise a question that we're seeing on Facebook and actually on our YouTube channel in Spanish as well. And that's regarding how we're going to continue to reach our Latinx population and get vaccines to our Latinx population as we open up the floodgates to 16 and over. And how are we helping to provide information to our Latinx residents so they can make the best decisions for them? And Jenny, I'm sure you're all quite capable of responding.
Yeah, so 2 per question, right? So the first one in ensuring how we're gonna make sure that so the county continues to prioritize and in communication with the providers that we're working with, folks who live in the lowest HPI and lowest 2 HPI. So that is how we are going to, with vaccine supply being so limited, that's where our focus will be, ensuring that folks actually, the supply that we do have goes specific census tracts. And the second part to the question, how are we going to continue to ensuring reaching out to this population? So continue working with our community-based organizations and uplifting the voices of those who are doing the work on the ground. Right now we have the CURA project. It's a proud program of the county that we continue to work with. And CURA itself, as an umbrella of multiple organizations, continues to work with other community-based organizations to continue that work, because we know there are going to be road bumps. We just had one with, as we know, as with trust, it's going to be a really important thing that we continue to work with our trusted messengers, and we will continue to support events that are led by community. As the county, that's kind of some of our strategies and methodologies that we're continuing to do. Kind of like centering community, right, at the base of our effort. It's going to be the key to do that. So,
thank you, Jenny. I appreciate that.
Anything to add? But yeah.
I mean, I just want to continue to say that we're trying to do a lot of work. The CBOs are the ones, the community-based organizations and the community activists are the ones that are doing this work. They're always doing this work because it's their community, right? And each CBO only has like 2 or 3 people, and they're giving all of their heart and soul and time and energy to serve their communities. And then we come out with them. We're doing events, we're doing online events, like where people can answer questions or ask questions. And then as Yesenia brought up the Cesar Chavez event, it was an amazing experience to bring community together and give them resources and sign them up for vaccines if they couldn't get one, vaccinate them on site. And really be there with trusted messengers, and then with those of us who could answer their questions and alleviate their concerns. And so continuing to work with community is definitely key.
Thank you, Jenny. That's really terrific information, and thank you, Jenny, as well. All right, Phil, you are up. You'll just have to unmute yourself.
Probably. I have a question about my turn and what will change regarding making appointments tomorrow. For instance, all of the county-supported clinics currently on the website, will those signups immediately migrate to my turn? And then I talked to Ken a little bit about this, but just so that I'm clear on it, how will it work with the big pharmacy chains and also with the big hospital networks like Kaiser? Do you know how much of that system will be migrating to my turn?
Yeah, Phil, thanks. Great questions. So tomorrow, some functionality will be improved in my turn. For example, the ability to geofence, for example, clinics, so that only individuals who indicate that they live or work in zip codes in a certain county can sign up for those clinics, for example. So we can, I hate to use the word protect, but protect the vaccines that are allocated to our county for our own residents. Now, and there are a number of other like language updates and so on that will be applied to the My Turn site as well. what doesn't change necessarily is the FQHCs or other providers, their requirement that they go on to My Turn tomorrow. Our providers in the county have been migrating. Some of them are already on there, and others are working to get there. And we're expecting most of them to be on certainly by the end of the month. Although we have indications by the third-party administrator that there may even be some flexibility beyond that. Now, in terms of functionality, almost think of it this way. There are a number of ways you can set up any clinic in My Turn, and that's done intentionally. So you could set up a clinic so that it could be open to anyone in the state and any eligibility. You could set up one now that is geofenced just to our county, but is still open to anyone. You can set up a clinic, or they will be adding functionality that could set up a clinic that has a single code, and we can sign people up, but it isn't open to the public. And then there's the one called a coded clinic, where we can actually hand out individual codes, and it's a one-time code that a person signs up for. So a whole bunch of different functionality now, but there's much more control because of that.
And can I take it that you, the county health staff, will share some of that control? You'll be able to direct some of that appointment making. When you say we'll be able to direct, remember that our model is that the federal healthcare programs and OptumServe and others are actually operating the clinics. And so they do most of that. And a lot of the control over that, they have to go through Accenture, which is the state's software designer, or I'm sorry, software support consultant that helps manage that. But yes, we have influence with our partners about what clinics may or may not be open. Great, thanks everyone.
Thank you, appreciate that. I think we have time for one more quick question before we wrap up. And Michael, you are up. You'll just have to unmute yourself.
Hello?
Hi, we can hear you.
Can you hear me?
Yes, thank you.
Okay, hold on, I can't hear you now. Hello?
Hi, can you hear us now?
Hold on one second.
It's okay. And Michael, you can feel free to actually just put your question on Facebook, and we'll be sure to follow up with you.
Hello, can you hear me?
Yeah, we can hear you.
Okay, 1 second, please.
Okay.
Jeez Louise. Okay, I want to ask about the 34 cases of hospitalization that the news thing mentioned about people who have been fully vaccinated and have come down with the COVID. And was there anything said about what type of vaccines those people had? Was there any commonality with that, with those people who came down with the COVID?
Yeah, thanks for that question. I think I'm going to turn this over to our epidemiologist, Jenny Mercado, to respond.
Yes, thank you. So just to be clear, those 39 cases actually were not hospitalized. One of them was hospitalized, but not for COVID. He was just tested at the hospital and had COVID. So these, all of these cases were just cases. I'm trying to remember the actual question here. Oh, yes. So, yes, so predominantly actually it was from the Pfizer vaccine, but we have to remember Pfizer is actually the vaccine that many of the healthcare facilities were giving to their healthcare workers in the beginning of the efforts to vaccinate. And those are the people that are continuing to be tested weekly or biweekly for their facilities. So those are the people that we would expect to catch as having COVID if they were going to be a case.
Do you mind if I weigh in on that one too? Is that okay, Michael?
Please, Brian.
Absolutely.
Just briefly, I think one of the things that that speaks to, I think, when you talk about people getting a reinfection, is that while we all really believe that vaccines are safer than getting coronavirus disease, the vaccines, none of them are absolutely 100%. And so people, this is sort of one of the intentions to try to get as many people vaccinated as possible, because as Dr. Mase was saying earlier, the more people that are vaccinated, the less chance there is to continue to spread coronavirus. One of the biggest reasons to get vaccinated is that even if you get a case of coronavirus that you test positive for from one of your nasal swabs, the chances of you having severe disease is almost nothing. Almost nobody who has been vaccinated has been hospitalized or died from coronavirus, and not almost nobody. So what that means essentially is that once you get vaccinated, even if you might get exposed to coronavirus and test positive as part of your sort of ongoing testing, you could be assured that you're not going to get that sick from it. And that's the real intention of the vaccination campaign, because we live as a society with normal winters where people get sick mildly or moderate illnesses, and we don't shut things down for that. We shut things down when people are going to die. And that's what happens with coronavirus disease when you have people who are unvaccinated. So I actually really like the fact that all these folks who might have tested positive after they've been vaccinated all had real mild, if barely any symptoms. That's so important for power for saying that people should get vaccinated.
And I just want to really quickly add that these vaccines are 94, 95% effective. And Dr. Shende, you calculated what percentage 39 is of the total number of people vaccinated. What percentage is that?
0.002%. So significantly less than 1%. And we're sure that there are going to be additional cases of people who are positive. And I think it's actually a good reminder to all of us that nothing is 100%. We know that. We've said that from the beginning. However, just as Brian said, it's going to eliminate the worst case outcomes of hospitalization and death. But it's also a reminder that even if one is vaccinated, for now, we still have to wear our masks. We still have to maintain mitigation measures. We still have to be careful. We don't know what the variants are going to do. Hopefully, we have beat the variants. Hopefully, we've got enough immunity built into our community at this point that we're going to be able to thwart it, and we're not going to have the outcomes that other parts of the country and other parts of the world have had. But we have to continue our preventive strategies to be careful and make sure that our community continues on the path towards healing.
Thank you, Dr. Shende. And I think that's just the perfect note to end on tonight. So I wanted to really thank all of our panelists for joining today. Our doctors out in the community doing this good work every day. Our experts here at Public Health, just thank you for being here. And I also wanted to thank some of our crew for being here, Odie on ASL and Maria, our Spanish interpreter. For more information, please, go ahead and go to socoemergency.org/vaccine. And you can also follow us on Facebook and Twitter. And we'll be back next Wednesday, 5 o'clock for our same community update. So thank you all for joining, for listening, and for learning. And we'll talk to you soon.